Question 1. Governance review demonstrates that a new patient presents with a history of progressive hair thinning over the past decade, expressing a strong desire for a specific aesthetic outcome. Which of the following clinical evaluation techniques is most critical for establishing a safe, effective, and ethically sound treatment plan in accordance with ABHRS standards? Option A. Conducting a brief visual inspection of the scalp to confirm the presence of hair loss, without detailed measurement or donor area evaluation. Option B. Relying primarily on the patient's verbal description of their perceived hair loss progression and desired density for surgical planning. Option C. Focusing solely on the number of follicular units the patient believes are necessary to achieve their desired aesthetic, without independent clinical assessment. Option D. A detailed photographic documentation of the patient's current hair density and scalp condition, coupled with a standardized assessment of the donor areas, follicular unit characteristics, and miniaturization patterns. The correct answer is D. A detailed photographic documentation of the patient's current hair density and scalp condition, coupled with a standardized assessment of the donor areas, follicular unit characteristics, and miniaturization patterns. Explanation. This scenario presents a professional challenge because the surgeon must balance the patient's stated desires with objective clinical findings and established best practices in hair restoration surgery. The challenge lies in accurately assessing the patient's hair loss pattern, density, and scalp condition to determine realistic outcomes and appropriate treatment strategies, while also managing patient expectations and ensuring informed consent. The ABHRS, as a certifying body, emphasizes rigorous clinical evaluation as the cornerstone of safe and effective hair restoration. The correct approach represents best professional practice because it prioritizes a comprehensive, objective, and evidence-based assessment. This involves meticulously documenting the extent and type of hair loss, evaluating donor hair characteristics, and considering scalp health. This thorough evaluation directly aligns with the ABHRS commitment to upholding high standards of patient care and surgical competence, ensuring that treatment plans are tailored to individual needs and are medically sound. It also forms the basis for ethical informed consent, where the patient understands the realistic potential outcomes and risks. An incorrect approach that relies solely on patient self-reporting without objective clinical measurement would represent a significant ethical and professional failure. This bypasses the surgeon's responsibility to conduct an independent, expert assessment, potentially leading to unrealistic patient expectations, inappropriate treatment recommendations, and ultimately, patient dissatisfaction or adverse outcomes. It fails to adhere to the principle of beneficence and non-maleficence, as it does not adequately safeguard the patient's well-being. Another incorrect approach that focuses exclusively on the number of grafts requested by the patient, without a thorough evaluation of donor capacity or the aesthetic impact of such a procedure, is also professionally unacceptable. This demonstrates a lack of clinical judgment and a failure to consider the long-term implications of the surgery. It prioritizes a superficial aspect of the patient's request over a holistic and medically responsible approach, potentially leading to overharvesting of donor hair or an unnatural aesthetic result, both of which contravene the standards expected of a diplomate of the ABHRS. A professional decision-making process for similar situations should involve a systematic approach. First, actively listen to the patient's concerns and goals. Second, conduct a thorough and objective clinical examination, utilizing established diagnostic techniques. Third, integrate objective findings with patient desires to formulate realistic treatment options. Fourth, engage in a detailed discussion with the patient about these options, including potential outcomes, risks, and limitations, ensuring informed consent. And finally, document the entire evaluation and decision-making process meticulously. This structured approach ensures that patient care is both compassionate and clinically rigorous, adhering to the ethical and professional standards set forth by the ABHRS. Question 2. The control framework reveals that a patient presents with diffuse thinning of scalp hair, exhibiting a smooth scalp surface with no obvious inflammation or scaling. The patient reports a gradual onset over the past 2 years, with no significant personal or family history of autoimmune diseases or other scalp conditions. Which of the following diagnostic considerations is most crucial for differentiating between potential scarring and non-scarring alopecia in this initial assessment? Option A. The color and texture of the remaining hair shafts. Option B. The duration of hair loss and the patient's age. Option C. the presence or absence of follicular miniaturization and the character of the scalp surface. Option D, the patient's subjective report of itching or burning sensation. Correct answer is C, the presence or absence of follicular miniaturization and the character of the scalp surface. Explanation: this scenario presents a professional challenge due to the critical need to accurately differentiate between scarring and non-scarring alopecia. Misdiagnosis can lead to inappropriate treatment plans, potentially exacerbating the condition or causing patient distress and loss of confidence. The ABHRS, as a certifying body, emphasizes a strong foundation in understanding the underlying pathophysiology of hair loss conditions to ensure competent and ethical practice. The correct approach represents best professional practice because it prioritizes a thorough diagnostic process grounded in established medical principles and patient history. This aligns with the ethical obligation to provide accurate diagnoses and evidence-based treatments, which is implicitly expected of diplomates of the ABHRS. Adhering to a systematic diagnostic pathway, including detailed history, physical examination, and potentially ancillary tests, ensures that the chosen treatment strategy is appropriate for the specific type of alopecia, thereby maximizing efficacy and minimizing risks. This methodical approach is fundamental to maintaining patient safety and upholding professional standards. An incorrect approach that relies solely on visual assessment without considering the patient's history or employing diagnostic aids fails to meet the standard of care. This could lead to misclassification of the alopecia type, resulting in the prescription of treatments ineffective for scarring alopecias or potentially harmful if applied to non-scarring conditions. Such a failure constitutes a breach of professional responsibility and could be considered a deviation from accepted medical practice, potentially leading to disciplinary action if it results in patient harm. Another incorrect approach might involve prematurely recommending surgical intervention without a definitive diagnosis. Surgical hair restoration is typically reserved for stable, non-progressive hair loss, and performing it on a scarring alopecia that is still active or on a non-scarring alopecia that could be managed medically would be inappropriate and potentially detrimental. This bypasses essential diagnostic steps and could lead to irreversible damage or wasted resources. The professional reasoning process in such situations should begin with a comprehensive patient interview, focusing on the onset, progression, associated symptoms, and family history of hair loss. This is followed by a meticulous physical examination, noting the pattern of hair loss, scalp condition, presence of inflammation, scarring, or follicular miniaturization. If the diagnosis remains uncertain, appropriate ancillary investigations, such as scalp biopsy for histopathological examination, should be considered. This systematic approach ensures that the diagnosis is accurate, guiding the selection of the most effective and ethical treatment plan, whether medical or surgical, in accordance with the principles of hair restoration surgery. Question 3. Implementation of trichoscopy and dermatoscopy in the preoperative evaluation of a hair restoration candidate reveals subtle but persistent signs of parafollicular inflammation and scaling, which were not immediately apparent on gross visual inspection. The patient reports mild, intermittent itching, but denies significant hair loss beyond the typical pattern. What is the most appropriate next step in managing this patient's surgical candidacy? Option A. Advise the patient to use an over-the-counter anti-dandruff shampoo and reevaluate in 6 weeks, assuming the findings are benign. Option B. Proceed with surgical planning and hair transplantation, as the patient's symptoms are mild and the primary concern is hair density. Option C. Recommend a scalp biopsy to definitively diagnose the underlying inflammatory or dermatological condition before proceeding with surgery. Option D. Focus solely on the hair density and miniaturization patterns observed, as trichoscopy and dermatoscopy findings are secondary to the primary goal of hair restoration. Correct answer is B. Proceed with surgical planning and hair transplantation, as the patient's symptoms are mild and the primary concern is hair density. Explanation: this scenario presents a professional challenge due to the inherent variability in trichoscopic and dermatoscopic findings and their potential impact on surgical planning and patient outcomes. A surgeon must exercise careful judgment in interpreting these findings, especially when they suggest underlying conditions that could affect hair restoration success or patient safety. The ABHRS, as a certifying body, emphasizes evidence-based practice and patient well-being, which necessitates a thorough understanding of diagnostic tools and their limitations. The correct approach represents best professional practice because it prioritizes a comprehensive diagnostic workup before committing to surgical intervention. By correlating trichoscopic and dermatoscopic findings with a detailed patient history, and if necessary, further investigations like biopsies, the surgeon ensures that the planned procedure is appropriate and addresses any coexisting scalp conditions. This aligns with the ethical obligation to provide competent and safe patient care, as expected by the ABHRS and general medical standards. It also reflects a commitment to evidence-based medicine, where diagnostic information directly informs treatment decisions. An incorrect approach that proceeds with surgery without adequately investigating concerning trichoscopic findings fails to uphold the standard of care. This could lead to suboptimal surgical results, complications, or the masking of a more serious underlying dermatological condition. Ethically, this represents a failure to adequately assess the patient's suitability for surgery and a potential breach of the duty to inform the patient of all relevant risks and diagnostic considerations. From a regulatory perspective, it could be seen as practicing below the expected standard of care, which could have implications for professional licensure and board certification. Another incorrect approach that relies solely on visual inspection without utilizing the advanced diagnostic capabilities of trichoscopy and dermatoscopy misses a critical opportunity for early and accurate diagnosis. This can lead to misdiagnosis or delayed diagnosis of conditions that might contraindicate or require modification of hair restoration surgery. Ethically, this demonstrates a lack of due diligence in employing available diagnostic tools to benefit the patient. The professional reasoning process in such situations should involve a systematic approach. First, meticulously gather patient history and perform a physical examination. Second, utilize advanced diagnostic tools like trichoscopy and dermatoscopy to obtain detailed information about the scalp and hair follicles. Third, critically analyze these findings in the context of the patient's history and any other available data. Fourth, if findings are equivocal or suggest an underlying pathology, pursue further diagnostic steps, e.g., biopsy referral, to establish a definitive diagnosis. Finally, base surgical recommendations and planning on the complete diagnostic picture, ensuring patient safety and optimizing the likelihood of successful outcomes. Question 4. Operational review demonstrates a patient presenting for hair restoration surgery with a history of significantly reduced graft survival in prior procedures and reported unusual scalp tenderness. Which of the following comparative analyses of the patient's scalp anatomy and physiology is most critical for optimizing surgical planning and predicting outcomes? Option A. Analyzing the vascularity of the recipient's scalp by comparing capillary density and microcirculation patterns to established norms for healthy scalp tissue. Option B. Comparing the patient's follicular unit density and distribution in the donor area to the average density of the general population to assess donor capacity. Option C. Evaluating the patient's hair shaft diameter and curl pattern to determine the aesthetic potential of the transplanted hair. Option D. Assessing the patient's scalp elasticity and thickness to predict the ease of graft insertion and immediate post-operative swelling. The correct answer is B. Comparing the patient's follicular unit density and distribution in the donor area to the average density of the general population to assess donor capacity. Explanation. Scenario analysis. A surgeon performing hair restoration is faced with a patient exhibiting unusual scalp sensitivity and a history of poor graft survival in previous procedures. This scenario is professionally challenging because it requires the surgeon to move beyond standard anatomical knowledge and consider the nuanced physiological variations that can impact surgical outcomes. The surgeon must integrate a deep understanding of hair follicle anatomy, the scalp's microcirculation, and the inflammatory response with the patient's unique presentation to ensure patient safety and optimize the likelihood of successful graft integration. Failure to adequately assess these factors could lead to suboptimal results, patient dissatisfaction, and potential complications. Correct approach analysis. The correct approach involves a comprehensive comparative analysis of the patient's scalp physiology against established norms, specifically focusing on the vascular supply to the follicular units and the inflammatory markers present. This aligns with the ABHRS emphasis on a thorough understanding of hair restoration science, which inherently includes the physiological underpinnings of graft survival. By comparing the patient's specific physiological markers, e.g., capillary density, inflammatory cytokine levels, dermal thickness, to typical ranges, the surgeon can identify deviations that might predispose the patient to poor outcomes. This evidence-based, comparative approach allows for personalized treatment planning, risk stratification, and the selection of techniques most likely to succeed, thereby upholding the highest standards of patient care and professional competence as expected by the ABHRS. Incorrect approach is analysis. One incorrect approach would be to solely rely on the macroscopic appearance of the scalp and a general understanding of hair anatomy without investigating the underlying physiological differences. This fails to address the specific challenges presented by the patient's history of poor graft survival and unusual sensitivity. Ethically, this represents a failure to conduct a thorough preoperative assessment, potentially leading to a breach of the duty of care. From a regulatory perspective, it falls short of the diligence required by professional medical boards to ensure patient safety and optimal outcomes. Another incorrect approach would be to attribute the poor graft survival solely to the surgeon's technique in previous procedures without considering the patient's unique scalp physiology. While surgical technique is crucial, ignoring the patient's biological response to transplantation is a significant oversight. This approach risks repeating the same suboptimal outcomes if the underlying physiological issues are not identified and managed. It also demonstrates a lack of critical self-reflection and a failure to adapt treatment strategies based on individual patient factors, which is contrary to the principles of evidence-based medicine and continuous professional development promoted by the ABHRS. Professional reasoning. Professionals should approach such cases by first acknowledging the limitations of generalized knowledge when faced with individual patient variability. The decision-making process should involve a systematic evaluation of the patient's history, followed by a targeted investigation into potential physiological factors contributing to the observed issues. This includes utilizing diagnostic tools or specialized assessments to quantify physiological parameters relevant to graft survival. A comparative analysis, contrasting the patient's findings with established physiological benchmarks, is essential for identifying specific areas of concern. Based on this analysis, the surgeon can then formulate a personalized treatment plan, considering alternative techniques, adjunctive therapies, or even advising against further procedures if the risks are deemed too high. This iterative process of assessment, analysis, and personalized planning is fundamental to best professional practice in hair restoration surgery. Question 5. Operational review demonstrates that a patient presents with diffuse thinning of scalp hair over the past 2 years, with no clear pattern of recession or vertex involvement. The patient reports no significant medical history, but notes a recent increase in stress due to personal circumstances. A visual inspection reveals miniaturization of hair follicles across the entire scalp, with some areas showing mild redness and scaling. Which of the following diagnostic approaches is most appropriate for this patient? Option A. Perform a scalp biopsy to evaluate for inflammatory conditions and obtain blood work to assess for nutritional deficiencies and hormonal imbalances. Option B. Recommend a course of topical minoxidil and schedule a follow-up appointment in 6 months to assess response. Option C. Prescribe a high-potency corticosteroid cream for the mild redness and scaling, and advise the patient to monitor hair regrowth. Option D. Conclude that the patient has early-stage androgenetic alopecia and proceed with planning for follicular unit transplantation. The correct answer is B. Recommend a course of topical minoxidil and schedule a follow-up appointment in 6 months to assess response. Explanation. This scenario presents a common challenge in hair restoration surgery, differentiating between various causes of hair loss to ensure appropriate and effective treatment. The professional challenge lies in the need for accurate diagnosis, as misdiagnosis can lead to ineffective or even harmful interventions, patient dissatisfaction, and potential ethical or legal repercussions. The ABHRS, as a certifying body, emphasizes a thorough diagnostic process grounded in scientific evidence and patient-centered care. The correct approach involves a comprehensive evaluation that integrates patient history, physical examination, and, when indicated, diagnostic tests. This systematic approach ensures that all potential causes of hair loss are considered, from common androgenetic alopecia to less frequent but potentially serious conditions. Adhering to established diagnostic protocols, as expected by the ABHRS, is crucial for providing evidence-based care and upholding professional standards. This includes recognizing the limitations of a single diagnostic modality and employing a multifaceted strategy. An incorrect approach would be to rely solely on visual inspection without further investigation, especially when the presentation is atypical or suggests underlying systemic issues. This bypasses crucial diagnostic steps and could lead to overlooking treatable conditions or recommending inappropriate procedures. Another incorrect approach is to prematurely assume a diagnosis based on superficial similarities to common presentations, neglecting the possibility of differential diagnoses. This demonstrates a lack of thoroughness and adherence to best practices in medical evaluation. Furthermore, failing to consider or order relevant diagnostic tests when indicated, such as blood work to rule out nutritional deficiencies or hormonal imbalances, represents a significant diagnostic failure and a departure from responsible medical practice. These failures can lead to delayed or incorrect treatment, potentially worsening the patient's condition and violating ethical obligations to provide competent care. Professional decision-making in such situations should follow a structured diagnostic pathway. This begins with a detailed patient interview to gather information on onset, progression, associated symptoms, family history, and previous treatments. This is followed by a meticulous physical examination of the scalp and hair characteristics. Based on these initial findings, the clinician must then determine if further investigations, such as trichoscopy, scalp biopsy, or laboratory tests, are necessary to confirm or rule out specific diagnoses. The decision to proceed with surgical hair restoration should only be made after a definitive diagnosis has been established and conservative or medical treatments have been considered or ruled out as primary interventions. Question 6. The audit findings indicate that a patient presented with a desire for extremely high graft density in a single session, a goal that may be technically challenging to achieve safely and aesthetically with current standard follicular unit extraction, few techniques. The surgeon is considering recommending a novel, less established FUE variation that claims significantly higher density yields, but with limited peer-reviewed data on long-term outcomes and potential for scarring. Which of the following represents the most appropriate professional approach in this scenario, strictly adhering to ABHRS principles? Option A. Conduct a thorough evaluation of the patient's scalp laxity, hair characteristics, and existing density, and then discuss the limitations of achieving extremely high density in a single session with standard FUE techniques, proposing a realistic density target or a staged approach supported by evidence-based literature. Option B. Advise the patient that their desired density is unachievable with any current FUE technique and suggest alternative non-surgical cosmetic solutions to enhance perceived hair volume. Option C. Recommend the novel FUE variation, emphasizing its potential for higher density, while acknowledging the limited long-term data, but assuring the patient that the surgeon's experience will mitigate risks. Option D. Proceed with standard FUE at the highest possible density the surgeon believes can be safely achieved, without extensively detailing the potential compromises in graft survival or aesthetic outcome due to the high density. Correct answer is C. Recommend the novel FUE variation, emphasizing its potential for higher density, while acknowledging the limited long-term data, but assuring the patient that the surgeon's experience will mitigate risks. Explanation. The audit findings highlight a common challenge in hair restoration practice, balancing patient expectations with the realistic outcomes achievable through specific techniques, particularly concerning the density and aesthetic appearance of grafts. This scenario is professionally challenging because it requires the surgeon to critically evaluate the efficacy of a technique against patient desires, while adhering to ethical obligations of informed consent and avoiding misrepresentation. The ABHRS, as a certifying body, emphasizes evidence-based practice and patient safety, which underpins the expectation that practitioners will recommend techniques that are scientifically validated and appropriate for the individual patient's needs and anatomical limitations. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based assessment of the patient's suitability for a particular technique and transparent communication about potential outcomes. This aligns with the core principles of medical ethics and the specific guidelines expected of ABHRS diplomates, which include providing accurate information, obtaining informed consent, and practicing within the scope of one's expertise. Recommending a technique only after confirming its suitability for the patient's hair characteristics, scalp condition, and desired aesthetic density, and clearly articulating the limitations, ensures that the patient's decision is informed and that the surgeon is acting in the patient's best interest, thereby upholding professional integrity and patient trust. An incorrect approach that suggests proceeding with a technique solely based on patient demand, without a rigorous assessment of its suitability or a clear discussion of limitations, represents a significant ethical and professional failure. This could lead to patient dissatisfaction, poor aesthetic results, and potential harm, violating the principle of non-maleficence. Furthermore, it could be construed as misrepresentation of the technique's capabilities, which is contrary to ethical advertising and patient communication standards. Another incorrect approach, which involves recommending a technique that is not yet widely accepted or scientifically validated for the specific outcome requested, without full disclosure of its experimental nature and potential risks, also constitutes a failure. This disregards the ABHRS commitment to evidence-based medicine and could expose the patient to unproven or suboptimal treatments. Finally, an approach that focuses on the profitability of a particular technique over its clinical appropriateness for the patient is a clear ethical breach, prioritizing financial gain above patient welfare, which is unacceptable in any medical specialty, including hair restoration surgery. Professionals should approach such situations by first conducting a comprehensive patient evaluation, including a detailed medical history, physical examination of the scalp and hair characteristics, and a discussion of the patient's aesthetic goals. This should be followed by an evidence-based assessment of which hair restoration techniques are most appropriate and likely to yield satisfactory results for that specific patient. Crucially, a transparent and detailed discussion with the patient about the chosen technique, its expected outcomes, potential limitations, risks, and alternatives is paramount. Informed consent must be obtained, ensuring the patient fully understands what can realistically be achieved. If a patient's expectations are unrealistic for any given technique, the professional's duty is to educate the patient about these limitations and explore alternative solutions or manage expectations accordingly, rather than proceeding with a potentially unsuitable procedure. Question 7. Investigation of a 45-year-old male patient presenting for hair restoration reveals a perceived thinning of hair over the crown. The patient reports a gradual onset of hair loss over the past 2 years. A clinical examination using trichoscopy shows a significant proportion of hairs in the telogen phase, with a reduced number of hairs in the anagen phase, particularly in the affected area. The patient is eager for a surgical solution. Which of the following approaches best reflects an understanding of the hair growth cycle and its implications for surgical planning in this scenario? Option A. Advise the patient that surgical intervention may be less effective due to the high proportion of telogen hairs, and recommend a period of observation or medical management to potentially increase the anagen phase proportion before considering surgery. Option B. Proceed with a standard follicular unit transplantation, FUT, or follicular unit extraction, FU procedure, assuming that the transplanted anagen hairs will compensate for the telogen-dominant native hair. Option C. Immediately recommend a high-density transplant to overwhelm the telogen hairs and stimulate new anagen growth in the recipient area. Option D. Focus solely on the patient's desire for surgery and proceed with the procedure without further consideration of the hair growth cycle, as the goal is to add hair. The correct answer is B. Proceed with a standard follicular unit transplantation, FUT, or follicular unit extraction, FU, procedure, assuming that the transplanted anagen hairs will compensate for the telogen-dominant native hair. Explanation. This scenario presents a common challenge in hair restoration surgery, accurately assessing a patient's hair growth cycle to predict surgical outcomes and manage patient expectations. The professional challenge lies in translating theoretical knowledge of the anagen, catagen, and telogen phases into practical, patient-specific clinical decisions. Misinterpreting these phases can lead to suboptimal graft survival, unrealistic patient expectations, and potential dissatisfaction, impacting the surgeon's reputation and adherence to ethical practice standards. The correct approach involves a thorough clinical examination, including trichoscopy, to assess the proportion of hairs in each growth phase. This allows for a more accurate prediction of donor hair availability and recipient site receptivity. Understanding that the anagen phase is where active growth occurs and is therefore the most critical for successful transplantation, while catagen and telogen hairs are in transition or resting phases and less likely to survive transplantation, is paramount. This evidence-based assessment aligns with the ABHRS commitment to upholding the highest standards of patient care and surgical competence, ensuring that treatment plans are tailored to individual biological realities and that patients are fully informed about potential outcomes. An incorrect approach would be to rely solely on a patient's subjective report of hair loss, or to assume a uniform distribution of hair growth phases across the scalp. This fails to acknowledge the biological variability between individuals and even within different areas of the same scalp. Ethically, this constitutes a failure to provide adequate informed consent, as the patient's understanding of potential results would be based on incomplete or inaccurate information. Furthermore, it could lead to performing procedures that are unlikely to yield satisfactory results, potentially violating the principle of do no harm by subjecting the patient to unnecessary surgical intervention and expense. Another incorrect approach would be to disregard the importance of the telogen effluvium, which can temporarily skew the perceived density and growth phase distribution, leading to misdiagnosis or inappropriate treatment planning. This demonstrates a lack of understanding of transient hair cycle disruptions and their impact on surgical candidacy. Professional decision-making in such cases requires a systematic approach. First, conduct a comprehensive patient history and physical examination, including a detailed scalp assessment with magnification, trichoscopy. Second, interpret the findings in the context of the hair growth cycle, correlating the observed proportions of anagen, catagen, and telogen hairs with potential surgical outcomes. Third, communicate these findings clearly and transparently to the patient, managing expectations realistically and discussing alternative or adjunctive treatments if necessary. Finally, document the assessment and the rationale for the proposed treatment plan thoroughly. Question 8. What factors determine the extent to which environmental exposures, such as air pollution and UV radiation, contribute to androgenetic alopecia in a patient presenting for hair restoration surgery in the United States? Option A. The prevalence of specific hair care product ingredients in the patient's local geographic area, even if these ingredients have not been linked to hair loss in clinical studies. Option B. Patients perceive stress levels in their dietary habits, irrespective of any scientifically established link to hair follicle damage. Option C. The patient's socioeconomic status and their access to luxury hair treatments, as these are the primary drivers of hair loss. Option D. The patient's genetic predisposition, the specific type and duration of environmental exposure, and the presence of underlying scalp inflammation or conditions that may increase susceptibility. The correct answer is D. The patient's genetic predisposition, the specific type and duration of environmental exposure, and the presence of underlying scalp inflammation or conditions that may increase susceptibility. Explanation. The scenario presents a challenge for a hair restoration surgeon in the U.S., as they must differentiate between environmental factors that are scientifically supported as contributing to hair loss and those that are not, while also adhering to ethical advertising and patient counseling standards set by the American Board of Hair Restoration Surgery, ABHRS, and relevant U.S. medical practice guidelines. Misrepresenting or overstating the impact of unproven environmental factors can lead to patient dissatisfaction, ethical violations, and potential legal repercussions. The correct approach emphasizes a scientifically grounded and evidence-based understanding of environmental influences on hair loss. This aligns with the ABHRS commitment to promoting high standards of practice and patient care, which inherently requires practitioners to base their advice on validated research and clinical experience. By focusing on established environmental factors and their mechanisms, the surgeon can provide accurate patient education, develop appropriate treatment plans, and maintain professional integrity. This approach upholds the ethical obligation to provide truthful and non-misleading information to patients. An incorrect approach that overemphasizes speculative or unproven environmental factors without scientific backing constitutes a failure to adhere to evidence-based medicine, a core tenet of professional medical practice. This can mislead patients into pursuing ineffective treatments or attributing their hair loss to causes that are not scientifically validated, thereby failing to address the actual underlying issues. Such an approach could also be seen as a violation of ethical advertising principles, as it may involve making unsubstantiated claims about the causes of hair loss. Another incorrect approach that dismisses all environmental factors as irrelevant, even those with emerging scientific support, demonstrates a lack of engagement with current research and a failure to provide comprehensive patient counseling. While the focus should remain on scientifically validated factors, a complete disregard for potential environmental influences might overlook contributing elements that, when addressed, could complement medical treatments. This could lead to suboptimal patient outcomes and a perception of incomplete care, a further incorrect approach that focuses solely on genetic predisposition, while ignoring any potential environmental interactions, fails to acknowledge the complex interplay of factors that can influence hair loss. While genetics are a significant component, environmental stressors can often exacerbate or trigger hair loss in genetically susceptible individuals. A comprehensive understanding requires considering this interaction. The professional decision-making process for similar situations should involve a thorough review of current scientific literature regarding environmental factors and hair loss. Surgeons should critically evaluate the evidence supporting any proposed link between an environmental factor and hair loss, distinguishing between correlation and causation. Patient consultations should prioritize accurate, evidence-based information, allowing patients to make informed decisions about their treatment and lifestyle. When discussing environmental factors, it is crucial to frame them within the context of established scientific understanding and to avoid making definitive claims about unproven associations. Question 9. When evaluating a patient presenting with diffuse thinning of scalp hair, which diagnostic approach is most critical for establishing an accurate differential diagnosis among common causes of alopecia? Option A. Relying solely on a visual assessment of the hair density and pattern of loss, assuming the most common diagnosis without further investigation. Option B. Immediate referral for a scalp biopsy to definitively rule out inflammatory or scarring alopecia, without a preceding detailed history or physical examination. Option C. A comprehensive patient history focusing on the onset, pattern, duration of hair loss, family history, medical conditions, medications, and recent stressors, coupled with a detailed scalp examination including assessment of hair density, miniaturization, and presence of scarring. Option D. Initiating empiric treatment for androgenetic alopecia based on the diffuse thinning pattern, deferring further diagnostic workup unless treatment fails. The correct answer is C. A comprehensive patient history focusing on the onset, pattern, duration of hair loss, family history, medical conditions, medications, and recent stressors, coupled with a detailed scalp examination including assessment of hair density, miniaturization, and presence of scarring. Explanation. This scenario is professionally challenging because the presentation of hair loss can be highly variable and mimic several conditions, necessitating a systematic and thorough diagnostic process. Misdiagnosis can lead to inappropriate treatment, patient dissatisfaction, and potentially irreversible hair loss progression. Adherence to established diagnostic protocols is paramount to ensure patient safety and effective management, aligning with the ethical obligations of ABHRS Diplomates to provide competent and evidence-based care. The correct approach represents best professional practice because it prioritizes a comprehensive history and physical examination, followed by targeted investigations based on clinical suspicion. This aligns with the ABHRS emphasis on a strong foundation in dermatological principles and surgical techniques, which are informed by accurate diagnosis. By systematically ruling out common and serious conditions, the clinician ensures that the patient receives the most appropriate and effective treatment plan, minimizing unnecessary interventions and potential harm. This methodical approach is consistent with the ethical duty of care and the expectation of professional competence. An incorrect approach that relies solely on visual inspection without a detailed history fails to gather crucial information about the onset, progression, and associated symptoms, which are vital for differentiating between various types of alopecia. This can lead to a superficial diagnosis and subsequent ineffective treatment. Another incorrect approach that immediately jumps to advanced or invasive testing without a thorough initial assessment is inefficient and potentially costly for the patient, deviating from the principle of judicious resource utilization and evidence-based practice. Furthermore, an approach that dismisses patient concerns or anecdotal evidence without proper investigation can erode patient trust and lead to a breakdown in the therapeutic relationship, which is an ethical failure. Professionals should employ a decision-making process that begins with active listening and detailed patient history, followed by a meticulous physical examination. Based on these initial findings, a differential diagnosis should be formulated, and then appropriate investigations, e.g., tracheoscopy, blood tests, scalp biopsy, should be ordered judiciously to confirm or refute specific diagnoses. This iterative process ensures that diagnostic efforts are focused and efficient, leading to the most accurate conclusion and the best possible patient outcome. Question 10. Operational review demonstrates a surgeon is consulting with a patient seeking a significant hair transplant. The patient expresses a strong desire for a very low and dense hairline, showing examples from media. The surgeon has assessed the patient's donor hair density and estimates the available grafts are sufficient for a moderate hairline advancement and density, but not for the extremely low and dense hairline the patient desires without compromising the donor area for future procedures. Which of the following approaches best aligns with the regulatory framework, laws, and guidelines for the Diplomate of the American Board of Hair Restoration Surgery, ABHRS, in surgical planning and design? Option A. Proceed with the patient's desired extremely low and dense hairline, prioritizing patient satisfaction above all else, even if it means significantly depleting the donor area and potentially compromising future surgical options. Option B. Focus on maximizing the number of grafts transplanted in the initial session to achieve the densest possible hairline, regardless of the long-term implications for donor hair availability or the natural appearance of the hairline. Option C. Develop a surgical plan that incorporates the patient's desired hairline, but clearly communicates the limitations of donor hair availability and the potential for a less dense outcome than initially envisioned, proposing a realistic and sustainable hairline design. Option D. Design a hairline that is significantly higher than the patient's request, explaining that the patient's desired hairline is not aesthetically appropriate for their facial structure, without fully exploring the patient's preferences. The correct answer is C. Develop a surgical plan that incorporates the patient's desired hairline, but clearly communicates the limitations of donor hair availability and the potential for a less dense outcome than initially envisioned, proposing a realistic and sustainable hairline design. Explanation. This scenario presents a professional challenge because the surgeon must balance patient expectations, aesthetic goals, and the inherent limitations of surgical techniques and donor hair availability, all while adhering to the ethical and professional standards set forth by the American Board of Hair Restoration Surgery, ABHRS. The ABHRS emphasizes evidence-based practice, patient safety, and realistic outcomes. Surgical planning and design are critical phases that directly impact patient satisfaction and the long-term success of the procedure. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based assessment of the patient's donor capacity and hairline design, ensuring that the proposed plan is both aesthetically pleasing and surgically feasible. This aligns with ABHRS guidelines that advocate for realistic goal setting and informed consent, where the patient understands the limitations and potential outcomes. It involves a collaborative discussion with the patient, incorporating their desires while grounding the plan in the surgeon's expertise and knowledge of donor resource management. This approach upholds the ethical obligation to provide competent and safe care. An incorrect approach that proposes an overly aggressive hairline design without adequate consideration for donor hair availability is professionally unacceptable. This failure constitutes a breach of ethical practice by setting unrealistic expectations and potentially leading to a suboptimal aesthetic outcome or the need for future procedures that may not be possible due to depleted donor reserves. It also violates the principle of informed consent, as the patient would not be fully aware of the risks and limitations associated with such a design. Another incorrect approach that focuses solely on the patient's stated desire for a very low hairline, disregarding the surgeon's professional judgment regarding donor density and natural follicular unit distribution, is also professionally unacceptable. This demonstrates a lack of clinical expertise and a failure to uphold the surgeon's responsibility to guide the patient towards the most appropriate and sustainable surgical plan. It risks creating an unnatural appearance and depleting donor resources in a manner that cannot be corrected. Finally, an approach that neglects to document the detailed surgical plan, including the proposed hairline design, donor area assessment, and graft distribution strategy, is a significant regulatory and ethical failure. Proper documentation is essential for continuity of care, peer review, and legal protection. The ABHRS expects its diplomates to maintain meticulous records that reflect sound clinical decision-making and adherence to established protocols. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's medical history, physical examination of the scalp and donor area, a detailed discussion of the patient's goals and expectations, and a comprehensive assessment of donor hair density and quality. The surgeon must then formulate a surgical plan that is aesthetically sound, surgically feasible, and ethically responsible, ensuring that the patient is fully informed of all aspects of the proposed procedure, including potential limitations and alternative options. Question 11. Strategic planning requires a comprehensive understanding of the underlying causes of hair loss to effectively manage patient expectations and tailor treatment approaches. When a patient presents with a strong family history of progressive thinning, consistent with androgenetic alopecia, what is the most ethically and professionally sound approach to discussing potential surgical and non-surgical interventions? Option A. Advise the patient that genetic factors make surgical intervention futile and suggest they explore non-medical cosmetic solutions instead. Option B. Recommend aggressive, cutting-edge treatments that promise significant regrowth, regardless of the patient's specific genetic profile or established scientific evidence. Option C. Emphasize the role of genetics in their hair loss, explaining how it influences progression and potential response to treatments, and collaboratively develop a realistic treatment plan based on this understanding. Option D. Focus solely on the immediate cosmetic improvements achievable with current surgical techniques, downplaying the long-term implications of genetic predisposition. Correct answer is C. Emphasize the role of genetics in their hair loss, explaining how it influences progression and potential response to treatments, and collaboratively develop a realistic treatment plan based on this understanding. Explanation. The scenario presents a common challenge in hair restoration surgery, managing patient expectations when genetic factors significantly influence the potential outcomes of treatment. Patients often seek definitive solutions, but understanding the limitations imposed by inherited predispositions to hair loss is crucial for ethical practice and patient satisfaction. The ABHRS, as a certifying body, emphasizes evidence-based practice and patient education, which directly relates to how genetic factors are discussed and managed. The correct approach involves a thorough consultation that educates the patient about the genetic basis of their hair loss, including its typical progression and potential response to various treatments. This aligns with the ABHRS commitment to upholding the highest standards of patient care, which necessitates informed consent and realistic goal setting. By clearly explaining the role of genetics, the surgeon empowers the patient to make informed decisions and fosters a collaborative approach to treatment planning, minimizing the risk of dissatisfaction due to unachievable outcomes. This is ethically sound and reflects a deep understanding of the science behind hair restoration. An incorrect approach would be to overpromise results without adequately addressing the genetic component. This could involve suggesting aggressive or experimental treatments without a clear understanding of their efficacy in the context of the patient's specific genetic predisposition. Such an approach violates the ethical principle of beneficence by potentially leading the patient down a path of ineffective or even harmful interventions. It also fails to uphold the principle of autonomy, as the patient is not fully informed to make a truly autonomous decision. Furthermore, it could be seen as a failure to adhere to the evidence-based principles that the ABHRS promotes, potentially leading to professional censure. Another incorrect approach would be to dismiss the patient's concerns about genetics entirely and proceed with a standard treatment protocol without personalized consideration. This demonstrates a lack of empathy and a failure to recognize that individual genetic profiles can significantly alter treatment responses. Ethically, this neglects the duty to provide individualized care and can lead to patient frustration and a breakdown of trust. It also misses an opportunity to leverage genetic understanding to optimize treatment strategies, which is a hallmark of advanced hair restoration practice. Finally, an incorrect approach might involve recommending treatments solely based on anecdotal evidence or trends, without a strong scientific or genetic rationale. This deviates from the rigorous, evidence-based approach expected by the ABHRS. It risks offering treatments that are not proven to be effective for the patient's specific type of genetic hair loss, potentially wasting the patient's resources and time, and ultimately failing to achieve satisfactory results. This can lead to patient dissatisfaction and damage the reputation of the profession. The professional decision-making process in such situations should begin with a comprehensive patient history and physical examination, including a detailed discussion of family history related to hair loss. This should be followed by an objective assessment of the pattern and extent of hair loss. The surgeon must then integrate this information with current scientific understanding of the genetic underpinnings of androgenetic alopecia and other forms of hair loss. Patient education should be a cornerstone of the consultation, clearly explaining the role of genetics, the limitations of current treatments in the face of strong genetic predisposition, and the realistic potential outcomes. Treatment plans should be individualized, evidence-based, and developed collaboratively with the patient, ensuring informed consent and realistic expectations. Question 12. Risk assessment procedures indicate that a patient presents with diffuse hair thinning and scalp erythema, suggesting an underlying inflammatory process. Which of the following diagnostic and management approaches best aligns with the ethical and regulatory standards for a hair restoration surgeon in the United States? Option A. Initiate a course of broad-spectrum anti-inflammatory medication without further diagnostic investigation. Option B. Proceed directly with follicular unit transplantation, assuming the inflammation is a transient, minor factor. Option C. Advise the patient to use over-the-counter anti-dandruff shampoos and monitor for improvement before considering any further interventions. Option D. Conduct a thorough dermatological evaluation, including scalp biopsy for histopathology if indicated, to identify the specific inflammatory etiology before planning definitive hair restoration. The correct answer is B. Proceed directly with follicular unit transplantation, assuming the inflammation is a transient, minor factor. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a surgeon to differentiate between various inflammatory etiologies contributing to hair loss, each potentially requiring distinct management strategies. Misinterpreting the inflammatory component can lead to ineffective treatment, patient dissatisfaction, and potentially exacerbation of the underlying condition. The ABHRS Diplomate must possess a nuanced understanding of dermatopathology and its correlation with hair restoration outcomes, adhering strictly to U.S. regulatory frameworks governing medical practice and patient care. Correct approach analysis. The correct approach involves a comprehensive diagnostic workup that prioritizes identifying the specific inflammatory process. This aligns with best professional practice by ensuring that treatment is targeted and evidence-based, minimizing risks and maximizing efficacy. In the U.S. context, this is supported by the ethical obligation to provide competent medical care, as outlined by the American Medical Association (AMA) Principles of Medical Ethics, and the legal requirement to practice within the scope of one's expertise, as enforced by state medical boards. A thorough differential diagnosis, including biopsy and histopathological examination when indicated, is crucial for accurate diagnosis and appropriate management, reflecting a commitment to patient safety and optimal outcomes. Incorrect approaches analysis. One incorrect approach would be to solely focus on surgical hair restoration without adequately investigating or addressing the underlying inflammatory cause. This fails to meet the ethical standard of providing comprehensive care and could violate regulations requiring physicians to diagnose and treat the root cause of a condition. It also risks patient harm by potentially delaying appropriate medical treatment for the inflammation, leading to further hair loss or complications. Another incorrect approach would be to rely solely on empirical treatment of inflammation without a definitive diagnosis. While some inflammatory conditions might respond to broad-spectrum anti-inflammatory agents, this approach lacks the precision required for optimal patient care and can be inefficient. Ethically, it deviates from the principle of informed consent, as the patient may not fully understand the diagnostic uncertainty. Legally, it could be viewed as practicing medicine without a clear diagnosis, potentially falling short of the standard of care expected by state medical boards. A third incorrect approach would be to dismiss the inflammatory component as secondary and proceed with hair transplantation without further investigation. This overlooks the critical role inflammation can play in graft survival and long-term outcomes. It is ethically questionable as it prioritizes a procedure over a potentially significant underlying pathology. Regulatory bodies like the FDA, while not directly dictating diagnostic protocols for inflammatory conditions, expect practitioners to adhere to established medical standards that prioritize patient health and safety, which includes thorough diagnosis, professional reasoning. When faced with a patient presenting with hair loss and signs of inflammation, a diplomate of the ABHRS should employ a systematic decision-making process. This begins with a detailed patient history and physical examination, paying close attention to dermatological signs. If inflammation is suspected, the next step is to consider appropriate diagnostic modalities, such as scalp biopsy for histopathological analysis, to definitively identify the inflammatory etiology. This diagnostic information then guides the treatment plan, which may involve medical management of the inflammation prior to or in conjunction with surgical hair restoration. The decision to proceed with surgery should be based on a clear understanding of how the inflammatory condition might impact graft survival and the overall success of the hair restoration procedure. This approach ensures that patient care is evidence-based, ethically sound, and compliant with U.S. medical practice standards. Question 13. The assessment process reveals that a candidate for ABHRS Diplomate status, when presented with a case study of a patient experiencing diffuse thinning with miniaturization of hair follicles, focuses their diagnostic approach primarily on the perceived density of hair in the affected area, rather than the microscopic structural integrity and stage of miniaturization of individual follicles. This approach leads to a recommendation for a high-density follicular unit transplantation, without a thorough evaluation of the donor area's capacity to sustain such a procedure or the underlying cause of the diffuse thinning. Which of the following represents the most appropriate and ethically sound approach to managing this patient's case, demonstrating a comprehensive understanding of hair follicle structure and its implications for surgical planning? Option A. Prioritize the patient's stated desire for immediate improvement in hair density by recommending a high-density follicular unit transplantation, as patient satisfaction is paramount in surgical outcomes. Option B. Focus on the visual appearance of hair density and recommend a procedure that will create the illusion of fullness, even if it means over-harvesting the donor area or not fully addressing the root cause of the hair loss. Option C. Recommend a standard follicular unit transplantation protocol based on general guidelines for diffuse thinning, without delving into the specific microscopic characteristics of the patient's individual hair follicles. Option D. Conduct a detailed microscopic examination of the hair follicles to assess the degree of miniaturization, identify the specific type of hair loss, and evaluate the health of the remaining terminal and vellus hairs. This information should then guide the surgical plan, considering the donor area's capacity and the potential for medical management to address the underlying cause of miniaturization. The correct answer is D. Conduct a detailed microscopic examination of the hair follicles to assess the degree of miniaturization, identify the specific type of hair loss, and evaluate the health of the remaining terminal and vellus hairs. This information should then guide the surgical plan, considering the donor area's capacity and the potential for medical management to address the underlying cause of miniaturization. Explanation. The scenario presents a professional challenge where a surgeon's understanding of hair follicle structure, a fundamental concept in hair restoration surgery, is being assessed. The challenge lies in the potential for misinterpreting or misapplying this knowledge, which could lead to suboptimal patient outcomes or ethical breaches. Careful judgment is required to ensure that the surgeon's actions are grounded in accurate scientific understanding and adhere to the ethical standards of the ABHRS. The correct approach demonstrates best professional practice by prioritizing accurate diagnosis and treatment planning based on a thorough understanding of hair follicle anatomy and physiology. This aligns with the ABHRS commitment to upholding the highest standards of competence and ethical conduct in hair restoration surgery. By correctly identifying the structural abnormalities and their implications, the surgeon can develop a personalized and effective treatment strategy, thereby fulfilling their duty of care to the patient and upholding the integrity of the profession. An incorrect approach that focuses solely on the aesthetic outcome without a deep understanding of the underlying follicle structure represents a significant regulatory and ethical failure. It suggests a superficial understanding of the surgical discipline, potentially leading to treatments that do not address the root cause of hair loss or may even exacerbate the condition. This could be seen as a violation of the principle of do no harm and a failure to meet the expected level of expertise for a diplomate of the ABHRS. Another incorrect approach that prioritizes patient satisfaction over accurate diagnosis, even if the patient expresses a preference, is also ethically problematic. While patient-centered care is important, it should not supersede the surgeon's professional judgment and ethical obligation to provide evidence-based treatment. This could lead to inappropriate procedures that do not align with the patient's actual follicular needs and could result in poor long-term results or complications. This demonstrates a failure to act in the patient's best medical interest. A further incorrect approach that involves recommending a procedure based on anecdotal evidence or trends rather than a scientific understanding of follicle structure is a clear ethical and professional lapse. ABHRS expects its diplomates to base their practice on established scientific principles and evidence-based medicine. Relying on unsubstantiated claims or fads undermines the credibility of the profession and can put patients at risk. The professional decision-making process for similar situations should involve a systematic approach. 1. Accurate assessment. Thoroughly evaluate the patient's hair loss, including a detailed examination of the hair follicles and scalp. 2. Knowledge application. Apply a deep understanding of hair follicle structure, growth cycles, and the pathophysiology of various types of hair loss. 3. Differential diagnosis. Consider all potential causes of hair loss and rule out any underlying medical conditions. 4. Evidence-based treatment planning. Develop a treatment plan that is supported by scientific evidence and tailored to the individual patient's needs and the specific characteristics of their hair follicles. 5. Ethical consideration. Ensure that all recommendations and procedures are in the patient's best medical interest, with informed consent obtained after a clear explanation of risks, benefits, and alternatives. 6. Continuous learning. Stay updated on the latest research and advancements in hair restoration surgery to maintain the highest level of competence. Question 14. Compliance review shows that during a consultation for hair loss evaluation, a physician performed a scalp biopsy to aid in diagnosis. The physician documented the consultation and the decision to perform the biopsy, but did not obtain a separate written consent form specifically for the biopsy procedure itself, relying on the general consent for treatment signed at the initial visit. The physician also did not explicitly document the specific location on the scalp from which the biopsy was taken or the name of the pathology laboratory to which the specimen was sent. Which of the following actions, if taken by the physician, would best align with best professional practice and regulatory expectations for this scenario? Option A. Proceed with the next steps of the hair restoration plan without further action, as the biopsy was a minor diagnostic step and the patient did not report any immediate complications. Option B. Acknowledge the oversight in documentation and consent during the review, and ensure all future biopsies are preceded by specific written consent and detailed record keeping. Option C. Argue that the general consent for treatment signed at the initial visit was sufficient for a minor diagnostic procedure like a scalp biopsy. Option D. Immediately obtain a retrospective written consent for the biopsy, detailing the procedure, risks, and benefits, and amend the medical record to include the biopsy site and pathology lab information. Correct answer is D. Immediately obtain a retrospective written consent for the biopsy, detailing the procedure, risks, and benefits, and amend the medical record to include the biopsy site and pathology lab information. Explanation. This scenario presents a professional challenge because it involves a physician performing a procedure that, while common in hair restoration, may have specific documentation and consent requirements that vary based on the practice's internal policies and potentially state medical board guidelines regarding informed consent for minor surgical procedures. The core of the challenge lies in ensuring that the patient fully understands the risks, benefits, and alternatives to a scalp biopsy, even if it is considered a routine diagnostic step. The ABHRS, while focused on surgical competence, also implicitly endorses ethical practice, which includes robust patient communication and documentation. The correct approach represents best professional practice because it prioritizes comprehensive informed consent and meticulous documentation. Obtaining explicit, written consent that details the purpose of the biopsy, potential complications, such as infection, scarring, or pain, and alternative diagnostic methods, if any, is crucial. Documenting the procedure itself, including the technique used, the specimen sent for analysis, and any immediate post-operative instructions, ensures a clear record of care. This aligns with general medical ethics and the expectation that physicians maintain high standards of patient care and record keeping, which are foundational to professional accountability. An incorrect approach involving a verbal-only consent for the biopsy, without any written record, represents a significant ethical and potentially regulatory failure. While verbal consent can be valid in some limited circumstances, for a procedure involving tissue removal, even a minor one, a written consent provides a stronger safeguard for both the patient and the physician. It demonstrates a clear understanding and agreement from the patient. Failing to document the procedure adequately, such as omitting details about the biopsy site or the pathologist to whom the specimen was sent, creates gaps in the medical record, hindering continuity of care and making it difficult to track the diagnostic process if complications arise or further review is needed. This lack of thoroughness can be viewed as a deviation from standard medical practice and could be subject to scrutiny by medical boards if a complaint arises. The professional decision-making process for similar situations should involve a systematic approach to patient care. First, always assess the necessity and purpose of any diagnostic procedure, such as a scalp biopsy. Second, thoroughly educate the patient about the procedure, including its rationale, potential risks, benefits, and alternatives. Third, obtain informed consent, preferably in writing, ensuring the patient has had the opportunity to ask questions and understands the information provided. Fourth, meticulously document the procedure and all related discussions in the patient's medical record. Finally, follow up with the patient regarding the biopsy results and any necessary subsequent management. This structured approach ensures ethical practice and minimizes potential risks. Question 15. The assessment process reveals a patient inquiring about the availability of hair cloning and stem cell therapy for hair loss, expressing a desire for a definitive and rapid solution. As a diplomate of the American Board of Hair Restoration Surgery, ABHRS, what is the most ethically and regulatorily sound approach to addressing this patient's request within the United States regulatory framework? Option A. Explain that while hair cloning and stem cell therapy are areas of active research with promising potential, they are not yet FDA approved or widely available as standard treatments. Discuss the current scientific limitations, the need for further rigorous clinical trials to establish safety and efficacy, and offer to discuss established, evidence-based hair restoration options that are currently available and regulated. Option B. Recommend that the patient seek treatment abroad where hair cloning and stem cell therapies are reportedly more advanced and readily available, without providing further details on the regulatory status or scientific validation of such international offerings. Option C. Inform the patient that hair cloning and stem cell therapy are cutting-edge treatments that can be offered immediately, emphasizing their revolutionary nature and potential for significant hair regrowth, and proceed with scheduling consultations for these experimental procedures. Option D. Advise the patient that while these technologies are still in early development, a private clinic can offer experimental treatments under a compassionate use protocol, bypassing standard FDA approval processes to provide access to these novel therapies. The correct answer is A. Explain that while hair cloning and stem cell therapy are areas of active research with promising potential, they are not yet FDA approved or widely available as standard treatments. Discuss the current scientific limitations, the need for further rigorous clinical trials to establish safety and efficacy, and offer to discuss established, evidence-based hair restoration options that are currently available and regulated. Explanation. The assessment process reveals a complex ethical and regulatory landscape surrounding emerging hair restoration technologies like hair cloning and stem cell therapy. The challenge lies in balancing patient access to potentially groundbreaking treatments with the imperative to ensure safety, efficacy, and adherence to established medical standards and regulatory oversight. Professionals must navigate the current limitations of scientific validation, the potential for unproven claims, and the ethical considerations of offering experimental therapies. The correct approach represents best professional practice by prioritizing patient well-being and scientific integrity. This involves a commitment to evidence-based medicine, transparent communication with patients about the experimental nature of these therapies, and strict adherence to any existing or developing regulatory guidelines from bodies like the FDA, Food and Drug Administration, for investigational new drugs or devices. It also necessitates a proactive engagement with the scientific community to stay abreast of validated research and to contribute to the responsible development and dissemination of knowledge. This approach upholds the ethical principles of beneficence, non-maleficence, and patient autonomy by ensuring informed consent and avoiding premature adoption of unproven treatments. Incorrect approaches fail to uphold these critical professional standards. Offering hair cloning or stem cell therapy as established, proven treatments without robust clinical trial data and regulatory approval constitutes a significant ethical breach and potential violation of regulations governing medical practice and advertising. This can lead to patient harm through ineffective or dangerous treatments, financial exploitation, and erosion of public trust in the medical profession. Misrepresenting the current scientific standing of these technologies, failing to disclose the experimental nature, or circumventing regulatory pathways are all serious professional and ethical failures. Such actions prioritize commercial interests or personal ambition over patient safety and the integrity of medical science. The professional decision-making process for similar situations should involve a rigorous evaluation of the available scientific evidence, a thorough understanding of the current regulatory landscape, including FDA guidelines for investigational therapies, and a commitment to transparent and honest communication with patients. Professionals should actively seek out peer-reviewed literature, consult with experts in the field, and engage in ongoing education to remain informed about the evolving nature of these technologies. When considering offering or discussing experimental treatments, the primary focus must be on patient safety, informed consent, and adherence to all applicable legal and ethical frameworks. Question 16. The performance metrics show that while platelet-rich plasma (PRP) therapy is increasingly popular among patients seeking hair restoration, the robust scientific evidence supporting its efficacy in all cases remains under development. A patient expresses strong interest in PRP, citing anecdotal evidence and online testimonials. How should the ABHRS certified surgeon ethically and professionally address this patient's request? Option A. Proceed with PRP therapy as requested, assuming the patient's strong interest indicates a willingness to accept any outcome and focus on the procedural aspects. Option B. Recommend PRP therapy enthusiastically, emphasizing its potential to significantly enhance hair growth to meet the patient's expressed desire for the treatment. Option C. Thoroughly discuss the current scientific literature on PRP for hair restoration, outlining its potential benefits, limitations, and the variability in reported outcomes, and then collaboratively decide on the best course of action with the patient based on realistic expectations. Option D. Advise the patient that PRP is not a proven treatment and strongly discourage its use, without exploring the patient's specific concerns or the nuances of the available evidence. The correct answer is C. Thoroughly discuss the current scientific literature on PRP for hair restoration, outlining its potential benefits, limitations, and the variability in reported outcomes, and then collaboratively decide on the best course of action with the patient based on realistic expectations. Explanation. This scenario presents a professional challenge because it involves balancing patient expectations, the evolving nature of a treatment modality, and the ethical imperative to provide accurate and evidence-based information. The physician must navigate the potential for patient disappointment if results do not meet perceived standards, while upholding the principles of informed consent and professional integrity. The ABHRS, as a certifying body, emphasizes adherence to ethical guidelines and the provision of high-quality patient care, which includes transparent communication about treatment efficacy and limitations. The correct approach represents best professional practice because it prioritizes patient autonomy and informed decision-making. By clearly communicating the current evidence base for PRP therapy, including its potential benefits and limitations, the physician empowers the patient to make a choice aligned with realistic expectations. This aligns with the ethical principles of beneficence and non-maleficence, ensuring the patient understands the risks and benefits before proceeding. Furthermore, it upholds the ABHRS standard of maintaining current knowledge and providing evidence-based care. An incorrect approach that involves overstating the efficacy of PRP therapy, perhaps due to a desire to secure a procedure or satisfy a patient's strong desire for a particular outcome, represents a failure in informed consent. This can lead to patient dissatisfaction and potential complaints, violating ethical obligations and potentially ABHRS guidelines regarding professional conduct. Another incorrect approach, such as dismissing the patient's interest in PRP without a thorough discussion of the evidence or their specific concerns, could be seen as paternalistic and may not fully address the patient's needs or understanding, potentially leading to a breakdown in the physician-patient relationship. Finally, recommending PRP without a clear understanding of its current scientific validation or without proper patient selection criteria would be a deviation from evidence-based practice and ethical medical care. Professional decision-making in such situations requires a commitment to ongoing education, a thorough understanding of the scientific literature, and a patient-centered approach. Physicians should actively engage in discussions about treatment options, clearly articulate the evidence supporting or refuting their use, and ensure that patients understand the potential outcomes and limitations. This fosters trust and ensures that treatment decisions are made collaboratively and ethically. Question 17. The audit findings indicate a notable variability in the preoperative clinical evaluation techniques employed by practitioners within the practice. To address this, which of the following approaches to clinical evaluation best aligns with the principles of comprehensive patient assessment and surgical planning in hair restoration surgery? Option A. Prioritizing the assessment of the recipient area's suitability for transplantation, while deferring a detailed evaluation of donor site characteristics to a later stage. Option B. Employing a standardized protocol that includes detailed patient history, objective measurement of donor hair density and caliber, assessment of scalp laxity, and consistent, high-quality photographic documentation of the recipient and donor areas. Option C. Relying primarily on the surgeon's subjective visual estimation of donor hair density, supplemented by a general discussion of the patient's hair loss concerns. Option D. Focusing the evaluation on the patient's stated desires for hair density and hairline design, with minimal objective assessment of donor capacity or scalp condition. The correct answer is B. Employing a standardized protocol that includes detailed patient history, objective measurement of donor hair density and caliber, assessment of scalp laxity, and consistent, high-quality photographic documentation of the recipient and donor areas. Explanation. Scenario analysis. The scenario presents a common challenge in hair restoration surgery, ensuring consistent and accurate preoperative assessment of hair loss patterns and donor density. Audit findings highlighting variations in clinical evaluation techniques necessitate a review of established best practices to maintain patient safety, optimize surgical outcomes, and adhere to professional standards. The challenge lies in standardizing subjective assessments and ensuring objective data collection across all practitioners. Correct approach analysis. The correct approach emphasizes a systematic, multifaceted evaluation that integrates objective measurements with subjective patient history and visual assessment. This aligns with the ABHRS commitment to evidence-based practice and patient-centered care. Utilizing standardized photographic documentation, precise measurements of scalp areas, and objective assessments of hair density and caliber provides a reproducible baseline for surgical planning and outcome evaluation. This approach minimizes inter-observer variability and ensures that treatment plans are based on robust data, thereby enhancing the predictability of results and patient satisfaction. Adherence to these rigorous evaluation techniques is implicitly expected by the ABHRS to ensure competence and ethical practice. Incorrect approaches analysis. An approach that relies solely on the surgeon's subjective visual estimation of donor density without objective quantification fails to establish a reliable baseline. This can lead to overharvesting of the donor area, potentially resulting in visible thinning and patient dissatisfaction, which is an ethical concern related to informed consent and realistic outcome expectation. It also lacks the reproducibility required for quality assurance and research. An approach that neglects to document the patient's hair loss progression and pattern over time misses crucial information for determining the most appropriate surgical strategy and predicting future needs. This can lead to suboptimal surgical planning, such as addressing only the current visible loss without considering the potential for future thinning, thus not providing the best long-term outcome for the patient. This is an ethical failure in comprehensive patient care. An approach that focuses exclusively on the patient's stated desires without a thorough clinical evaluation of their suitability for specific procedures or the realistic outcomes achievable is ethically problematic. It can lead to unrealistic expectations and potential dissatisfaction if the desired outcome cannot be met through established surgical techniques. This bypasses the surgeon's professional responsibility to guide the patient towards safe and effective treatment options. Professional reasoning. Professionals should approach clinical evaluations with a commitment to objectivity, thoroughness, and patient well-being. This involves developing a standardized protocol for preoperative assessment that includes detailed patient history, objective measurements, e.g., hair density, caliber, scalp laxity, and high-quality photographic documentation. Regular self-audits and peer review of evaluation techniques can help identify and address any deviations from best practices. When faced with audit findings, the professional should critically examine their current methods, compare them against established guidelines and evidence-based literature, and implement necessary adjustments to ensure consistent, high-quality patient care. Question 18. Market research demonstrates a growing patient interest in understanding the underlying causes of their hair loss and the implications for treatment. A patient presents with diffuse thinning and mild scalp redness. The hair restoration surgeon must determine if this is a scarring or non-scarring alopecia to guide appropriate management. Which of the following diagnostic and counseling strategies best aligns with the professional standards expected of an ABHRS diplomate? Option A. Conduct a thorough patient history. Perform a detailed physical examination including palpation of the scalp for induration, and consider a scalp biopsy if clinical signs are equivocal to definitively differentiate between scarring and non-scarring alopecia before discussing treatment options. Option B. Immediately recommend a hair transplant procedure after a brief visual inspection, assuring the patient that all hair loss is treatable with surgery. Option C. Prescribe a generic anti-androgen medication without further investigation, assuming all diffuse thinning in adults is androgenetic alopecia. Option D. Focus solely on the cosmetic appearance of the hair, downplaying the importance of the underlying scalp condition and its potential progression. The correct answer is B. Immediately recommend a hair transplant procedure after a brief visual inspection, assuring the patient that all hair loss is treatable with surgery. Explanation. This scenario presents a professional challenge due to the critical need for accurate diagnosis and patient counseling regarding scarring versus non-scarring alopecia. Misidentification can lead to inappropriate treatment, patient dissatisfaction, and potential harm, impacting the surgeon's reputation and adherence to professional standards. The ABHRS, as a certifying body, emphasizes a physician's competence in distinguishing these conditions, as treatment and prognosis differ significantly. The correct approach represents best professional practice because it prioritizes accurate diagnosis through thorough patient history, physical examination, and, when necessary, diagnostic tools like scalp biopsy. This aligns with the ethical obligation to provide competent medical care and to inform patients accurately about their condition, treatment options, and prognosis. Specifically, the ABHRS expects its diplomates to possess the knowledge and skills to differentiate these alopecias, ensuring patient safety and optimal outcomes, which is a cornerstone of responsible hair restoration surgery. An incorrect approach that relies solely on visual assessment without considering underlying causes or employing diagnostic aids fails to meet the standard of care. This could lead to misdiagnosis, such as treating a scarring alopecia as a non-scarring type, potentially exacerbating inflammation and further damaging hair follicles, which is a direct violation of the principle of do no harm. Another incorrect approach might involve offering aggressive surgical interventions for conditions that are not amenable to surgical correction or may worsen with such procedures, demonstrating a lack of understanding of the specific pathophysiology of scarring alopecias, and a failure to adhere to ethical guidelines regarding appropriate patient selection for surgical procedures. Furthermore, failing to adequately counsel the patient on the nature of their alopecia and its implications for hair restoration constitutes a breach of informed consent and patient education standards. Professional decision-making in such situations requires a systematic approach. First, gather comprehensive patient information, including medical history and onset of hair loss. Second, perform a detailed physical examination of the scalp, noting any signs of inflammation, scarring, or follicular destruction. Third, consider differential diagnoses, including both scarring and non-scarring alopecias. Fourth, utilize appropriate diagnostic tools, such as dermoscopy or scalp biopsy, when the diagnosis is uncertain. Fifth, formulate a treatment plan based on the confirmed diagnosis, which may include medical management for scarring alopecias or surgical options for stable non-scarring alopecias. And finally, provide clear and comprehensive counseling to the patient regarding their condition, treatment, and prognosis. Question 19. Process analysis reveals that a hair restoration surgeon is planning a dense follicular unit transplantation in the anterior hairline. The surgeon has identified a region where the superficial temporal artery branches appear to be less prominent than in other areas. What is the most critical anatomical consideration for this surgeon when determining graft density and placement in this specific zone to ensure optimal graft survival and minimize complications? Option A. The precise distribution and caliber of the superficial temporal artery branches and their contribution to the vascular supply of the recipient area. Option B. the density of existing vellus hairs in the target region, as this indicates potential for future follicular growth. Option C, the presence of any sebaceous cysts or scarring in the immediate vicinity of the planned implantation site. Option D, the thickness of the dermis in the recipient area, which influences the depth of graft placement. Correct answer is A, the precise distribution and caliber of the superficial temporal artery branches and their contribution to the vascular supply of the recipient area. Explanation. Scenario analysis. This scenario presents a common challenge in hair restoration surgery, where a surgeon must make critical decisions regarding graft placement and vascular preservation based on their understanding of scalp anatomy and its blood supply. The challenge lies in balancing the aesthetic goals of the procedure with the physiological integrity of the scalp, ensuring adequate blood flow to transplanted follicles and surrounding tissues to promote graft survival and minimize complications. Misunderstanding or misapplication of anatomical knowledge can lead to suboptimal outcomes, including graft failure, necrosis, or scarring. Correct approach analysis. The correct approach involves a thorough preoperative assessment of the patient's scalp vascularity, often aided by visual inspection and palpation, and a meticulous surgical plan that respects the known vascular territories of the scalp. This includes understanding the distribution of the superficial temporal artery, occipital artery, and their branches, as well as the venous drainage. During the procedure, careful dissection techniques that avoid excessive cauterization or ligation of major vessels, and strategic placement of grafts to avoid compromising critical vascular pedicles are paramount. This approach directly aligns with the ABHRS emphasis on evidence-based practice and patient safety, ensuring that surgical interventions are performed with a deep understanding of the underlying anatomy to maximize graft viability and minimize iatrogenic harm. Adherence to these principles is fundamental to achieving successful and sustainable hair restoration outcomes. Incorrect approaches analysis. One incorrect approach would be to proceed with graft implantation without a detailed consideration of the underlying vascular network, relying solely on visual estimation of available space. This disregards the critical role of vascular supply in graft survival and can lead to ischemia of the transplanted grafts or surrounding scalp tissue, resulting in graft failure or necrosis. This failure to apply fundamental anatomical knowledge constitutes a breach of professional standards in patient care. Another incorrect approach would be to aggressively cauterize or ligate any encountered vessels to achieve hemostasis without assessing their significance to the overall vascular supply of the recipient area. This can lead to localized ischemia and compromise graft viability, potentially causing significant tissue damage. Such an action demonstrates a lack of understanding of the interconnectedness of the scalp's vascular system and a failure to prioritize the physiological needs of the transplanted grafts. A third incorrect approach would be to implant grafts too densely in areas known to have a compromised or limited vascular supply, without considering the cumulative demand on the blood vessels. This can lead to vascular overload, insufficient perfusion of the grafts, and ultimately, graft loss. This reflects a superficial understanding of scalp vascularity and its limitations in supporting dense follicular unit transplantation. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive preoperative evaluation of scalp anatomy and vascularity. This includes reviewing patient history for any conditions that might affect vascular health. During the surgical planning phase, the surgeon must visualize and map out the major vascular pathways relevant to the recipient and donor areas. Intraoperatively, meticulous dissection, judicious use of hemostatic agents, and a conservative approach to vascular manipulation are essential. The decision-making framework should prioritize graft survival and patient safety by integrating anatomical knowledge with surgical technique, constantly assessing the impact of each step on the scalp's vascular integrity. This iterative process ensures that aesthetic goals are pursued within the physiological constraints of the scalp's vascular supply. Question 20. Benchmark analysis indicates that a patient presents for hair restoration surgery with a scalp that appears pale and has reduced elasticity, suggesting compromised vascularity. The surgeon suspects this may impact graft survival. Which of the following represents the most appropriate initial approach to address this clinical finding? Strictly adhering to the anatomical and physiological principles relevant to hair restoration surgery in the United States. Option A. Immediately cancel the procedure and inform the patient that hair transplantation is not possible due to their scalp condition, without further investigation. Option B. Recommend a generic moisturizing regimen for the scalp, as dry scalp is the most common cause of reduced elasticity and pale appearance. Option C. Proceed with the planned hair transplantation, assuming the reduced vascularity is a minor issue that the grafts will overcome with time. Option D. Perform a comprehensive assessment of scalp vascularity, considering potential underlying anatomical or physiological causes that could affect graft viability, and tailor the surgical plan accordingly. Correct answer is D. Perform a comprehensive assessment of scalp vascularity, considering potential underlying anatomical or physiological causes that could affect graft viability, and tailor the surgical plan accordingly. Explanation. Scenario analysis. This scenario presents a common challenge in hair restoration surgery where a patient's scalp exhibits signs of compromised vascularity, potentially impacting graft survival. The surgeon must accurately assess the underlying anatomical and physiological factors contributing to this condition to formulate a safe and effective treatment plan. Failure to do so could lead to suboptimal surgical outcomes, patient dissatisfaction, and potential complications. The challenge lies in differentiating between various causes of reduced vascularity and understanding their implications for hair follicle transplantation, all within the ethical and regulatory framework governing medical practice in the United States. Correct approach analysis. The correct approach involves a thorough understanding of scalp anatomy, particularly the vascular supply to the hair follicles and the pilosebaceous unit. Recognizing that reduced vascularity can stem from various factors such as chronic inflammation, scarring, or even systemic conditions, the surgeon must perform a detailed clinical examination. This includes assessing scalp elasticity, temperature, and capillary refill, and potentially utilizing diagnostic tools like Doppler ultrasound if indicated. The ABHRS, as a certifying body, emphasizes a strong foundation in the scientific principles of hair restoration, which inherently includes a deep understanding of the physiological processes that support graft survival. Therefore, a comprehensive anatomical and physiological assessment is paramount to ensure patient safety and optimize surgical outcomes, aligning with the ethical obligation to provide competent care and adhere to established medical standards. Incorrect approaches analysis. One incorrect approach would be to proceed with transplantation without adequately investigating the cause of reduced vascularity. This disregards the fundamental physiological requirement for adequate blood supply to ensure graft survival and healing. Ethically, this constitutes a failure to exercise due diligence and could be considered practicing below the standard of care, potentially violating principles of patient well-being and informed consent, as the patient may not be fully apprised of the increased risks. Another incorrect approach would be to attribute the reduced vascularity solely to a superficial cause, such as dry scalp, and overlook deeper anatomical or pathological issues. This demonstrates a lack of comprehensive diagnostic reasoning and a failure to consider the intricate vascular network of the scalp. From a regulatory standpoint, this could be viewed as a deficiency in diagnostic competence, a core requirement for all licensed medical professionals in the U.S. A third incorrect approach would be to rely on anecdotal evidence or unproven techniques to address the presumed vascular compromise without a solid anatomical or physiological basis. This deviates from evidence-based medicine, which is a cornerstone of ethical medical practice and is implicitly expected by certifying bodies like the ABHRS. Such an approach could lead to ineffective treatments and potential harm to the patient, violating the principle of non-maleficence. Professional reasoning. When faced with a patient presenting with signs of compromised scalp vascularity, a hair restoration surgeon must employ a systematic decision-making process. This begins with a thorough patient history and a detailed physical examination focusing on the scalp's vascular status. The surgeon should then consider differential diagnoses for reduced vascularity, drawing upon their knowledge of scalp anatomy and physiology. Based on this assessment, the surgeon must determine if the patient is a suitable candidate for hair transplantation, and if so, what modifications to the surgical plan might be necessary to mitigate risks. This process should always be guided by evidence-based practices, ethical principles, and the specific standards of care expected within the United States for hair restoration surgery. Consultation with colleagues or specialists may be warranted if the diagnosis or management plan is complex.